Hello, everyone, and thank you for being on the call today. I'd like to welcome everyone back to the CDC's Point of Sale Strategies webinar series. It's been a while since we've had one of these. Welcome back to all of those who've attended our webinars in the past. And hello and welcome to those that have not previously been a part of this series. My name is Asha Banks, and I am today's facilitator. I am a project officer in the CDC's Office on Smoking and Health. I've been sending out notices about these webinars for some time now, and my role has changed over the years. But I'm very excited about today's webinar. We have an exciting new resource to share and a great community that will share their experience. So for today's agenda, we're really excited about partnering with ChangeLab Solutions on this webinar, and we've been learning a lot from our working relationship with them. First, we're going to talk about the focus of the webinar is, the title is It's Go Time, Tobacco Retailer Licensing Playbook. Tobacco retailer licensing has really emerged as a foundational tool and element of tobacco work at the point of sale. And not only has it been an effective regulatory approach, but it can be used to implement other strategies at the retail environment. Many communities across the country are looking to implement a tobacco retailer licensing policy, or TRL, or strengthen existing policies. And ChangeLab Solutions has developed a great new resource called the Tobacco Retailer Licensing Playbook, and that's the first thing we'll talk about in the agenda. And then the second thing is we'll have a conversation with Los Angeles County to hear about their experience with tobacco retailer licensing policies. The guest speakers for today are Ian McLaughlin, Senior Staff Attorney and Program Director at ChangeLab Solutions, Monty Messick, and Anina Pakamthamanam from Los Angeles County Department of Public Health in California will be sharing their experiences. So with that, I will hand it over to Ian with ChangeLab.
Wonderful. Thank you very much, Asha, and good morning and good afternoon, everybody on the line. Very pleased to see so many people were able to join us today. This is Ian McLaughlin, and I'm with ChangeLab Solutions in Oakland, California. I hope I have worked or met most of the participants. If not, I would like to hopefully have a chance to meet you soon. For the next 20 minutes or so, I'm going to be talking about the Tobacco Retailer Licensing Playbook that Asha just mentioned, which is a new resource that we put out, really focusing on tobacco retailer licensing. And first, I'd like to take just a brief moment and say what this talk will not be, and it will not be the basics about what tobacco retailer licensing is or how it operates. Hopefully all the participants have had a chance to listen in on some of our previous webinars on that topic. And if you haven't, we have one archived on our website, changelabsolutions.org. Basically, it's Tobacco Retailer Licensing 101. It's an hour on the ins and outs of what licensing is and how it works. I will just say briefly, though, tobacco retailer licensing is a regulatory system whereby the government requires tobacco retailers to get a special license for the privilege of selling tobacco products in the community, and then the government is able to use that license to hold those retailers to certain performance standards or conditions of operation. And if the retailers fail to live up to those expectations and performance standards, then the government has the right to take away the privilege temporarily or permanently for the retailers to sell tobacco. So it's a very powerful and effective regulatory tool for the retail environment, and particularly we have found at the local level, although I think there's great promise for state level licensing as well. So that's the 3-minute TRL 101, and now we are going to talk a little bit more about the playbook itself. But before we get into that, I'd like to survey the participants to see where everybody's at in their work. And so you'll have a chance to respond to this poll question on the next slide, which is, are you doing any tobacco policy work in the retail environment? And here are the responses. You can click one and then hit submit. Either you're focused on other priorities at the moment, and there are many other core strategies. You're considering some retail environment work and just getting started, or you have tobacco retailer licensing already, or the last response is you're ready for a larger fight in the store. So click on your response and hit submit, and let's see where we are. Wonderful. It looks like we have a broad range. The bars of the graph will continue to change as people submit their responses, but we have a broad range, including lots of communities, apparently 36%, 37% that are ready for to take on the war in the store. And we also have a large percentage, about 40, that are considering retail environment work, which is fantastic. Others are still focusing on the other tobacco priorities, such as smoke-free air and tobacco excise taxes, and some have licensing but might be considering the next step. So thank you, everybody, for hitting your response and submitting that. It's great to see such a broad range of participants on this webinar. And I'll go to the next slide and show basically the table of contents of the playbook. And I think the good news is, since we have such a broad range of participants, I think the playbook has something for everyone, because licensing really is something for every community, no matter where you are in the process. This on the screen now is, as I said, the table of contents of the licensing playbook. And it lists 10 steps, essentially, to getting licensing going in your community. From number 1, conducting an environmental assessment, all the way down to number 10, which is additional uses for TRL, like how can you use it beyond just the basic core principles of licensing that I'll go into. I'm going to go through each one of these elements one at a time and talk about them in a little more detail. But I do want to say a couple of things about the playbook. It lists the 10 steps for tobacco retailer licensing, and it's really the information that we have gleaned from working in the field. In California, there are well over, I think it's now 130 communities that have local tobacco retailer licensing, and our office has worked with the vast majority of those communities over the last 2 decades, and I have been working with them for the last 8 years on this subject. And this playbook reflects the elements or the steps towards licensing that we have learned during that process. And we are not experts here at ChangeLab Solutions in all of these strategies, but a few of them we are, such as the legal aspects. However, the playbook is really designed to set forth the different strategies and then to connect users to examples from the field and resources for each step. So for example, I will go through some of the resources for conducting an environmental assessment, for example, or convening a community coalition. There are some organizations doing some great work on this subject, and those are the resources we'd like to connect you with through the playbook. The playbook provides the overview, and as you dive deeper into each step, then you're going to have to really connect with other resources and our resources as well. The other thing I would like to point out about the 10 steps here is that although we list them out 1 through 10, it's really an iterative process. And it doesn't just happen step 1, then step 2, and then step 3. Really, it could happen in, a lot of these happen concurrently at the same time, and some steps might occur before another step, even though it's listed in the playbook afterwards. Because it's an iterative process, it's not necessary to be wedded to this exact order, but I will say there are a few buckets that are represented here on steps 1 through 10. And the first bucket is really the foundational work or the planning work. So that is doing your environmental assessment, doing the legal work, getting your coalition together, that sort of thing. The next bucket is really sort of sitting down and getting your policy in order. That is drafting it up, getting it adopted, working with the agencies that are going to implement and enforce it. And then the third bucket is really after you have it in place and it's starting to be enforced, what next? Well, the evaluation and data collection component, and then considering where you go from there. And we're fortunate today we have Los Angeles County who's going to be talking about their experience with tobacco retailer licensing in a few moments. And they have been through most of these steps and are a good case study about from beginning to end how you get from step 1 to step 10 and where do you go after step 10. So with that, I will start getting into the steps as soon as I talk about one more sort of foundational issue, and that is it's called tobacco retailer licensing, and traditionally it has been a regulatory system to regulate sales of tobacco products. But at this point in the evolution of the tobacco industry, it begs the question a little bit, what is a tobacco product? Because traditionally, most state laws and many local laws define it as a product containing tobacco leaf. And for a long time that was the case, but now there are a whole host of new products on the market, including particularly electronic products that won't contain tobacco leaf but do contain nicotine, whether it's synthetically derived nicotine or nicotine derived from tobacco. So what is a tobacco product? I would just offer that tobacco retailer licensing is a way to regulate any product that is sold that contains tobacco or that contains nicotine, or even if you want to stretch it even further, some of these electronic products or emerging products don't even contain nicotine, can be wrapped into the definition of tobacco product. So I don't want to use this as a discussion of whether or how to regulate electronic products and whether it's a good idea. That's another topic for another time. But I just want to say that when you're considering licensing, you can consider it very broadly to as a way to regulate both what we traditionally have regulated as tobacco products or any of these emerging products as well. It's just a matter of how you define tobacco product. So now let's look at each one of these steps in a little bit more detail. And the first two steps are really the foundational work to help you answer the question, why would you want licensing in the first place? In other words, what is the problem that you're going to address? And the first step in that process is really to find out what's going on in your community by conducting an environmental assessment. And an environmental assessment looks at the tobacco retail sales environment sort of writ large by looking at who's selling tobacco, what types of stores, and where are they in your community. Where are they located, and what kinds of stores are they, and how are they selling? What kinds of, are they selling to minors or are they not selling to minors? What is the youth purchase rate? It's really a way to get a handle on what kind of tobacco sales are going on in your community. And that really goes a long way towards defining the problem that you want to address with tobacco retailer licensing. You can use the data that you got, just the basic environmental data, to say, well, there's a lot of tobacco retailers near schools, for example, and that's a problem in our community. Or, as we have seen in several cases recently, in low-income neighborhoods or neighborhoods that are predominantly communities of color, there are disproportionately high numbers of tobacco retailers clustered there, and that's really an equity problem that we want to address. Or, what has traditionally been the case for tobacco retail licensing is we find that our sales to minors rate is just too high, and the laws we have on the books at the state level are just not working. So for any one of these types of problems, retailers near schools or just too many retailers densely clustered in certain neighborhoods or sales rates too high, the environmental assessment can really help you get to the bottom of that. And I just want to have a quick note that there's a few organizations that can really help you with your environmental assessment. You probably know of the resources countertobacco.org and Counter Tools, which are based in North Carolina, and they have some great resources on this subject. And then the environmental assessment, like I said, sort of takes a bird's eye view, and if you want to get a little deeper, you can use an assessment tool to look inside the store about what's going on with sales and promotion of tobacco there. The Standardized Tobacco Assessment for Retail Settings tool, which has recently developed to look at the availability, placement, promotion, price of tobacco products inside the store, and gets you a little better handle on what's going on with sales on the inside rather than just where retailers are located or whether or not they're selling to minors. Anyway, so the first two steps are really designed to get a handle on what the issues are in your community with sales that really builds the foundation for everything else that you're going to be doing with licensing. The third step is, of course, near and dear to my heart, and that is to assess the legal landscape. In today's age, you can't do anything without good lawyers, and so it's really important early on to engage legal counsel to analyze federal, state, and local laws and court decisions to determine the scope of what you can do with licensing, especially at the local level. The good news is at the federal level there is no federal law that prohibits any local licensing, so that work is not very difficult. But there are a lot of state laws out there that might impact what you can do with local licensing, and so it's important to have legal counsel analyze that and tell you what you can do and what you cannot do. The good news is even if your state might prohibit some forms of licensing for tobacco products, there might be other things you can do, for example, to use licensing to address electronic products. And probably the scope of preemption is not complete so that you can't do anything at all with local licensing. But again, that's a very nuanced legal analysis that must be done, so engaging legal counsel is important for that. There are many legal organizations that can help with this. Many states are served by a legal technical assistance provider. The Tobacco Control Legal Consortium based in Minnesota, Minneapolis, provides national technical assistance on this, as do we here at Change Lab Solutions. We are able to help with this legal analysis, but regardless of the source that you use, it's tremendously important to have this done early on. Okay, so the next couple of steps are, once you have a handle on the problem and you have addressed your legal climate, is really to start your organizing. And this is where I think the knowledge of the participants on this call is far greater than mine. But I've seen it in action in Los Angeles. We'll hear about their experience. I've seen it in action throughout California. And it's very powerful when you have a coalition or a community group at the local level starting to do this community organizing work. And when they're including youth in it as well, it's tremendously powerful. I've seen that in California. I noted that traditionally here anyway, tobacco retailer licensing was a policy focused on preventing youth sales, and so that youth component was really powerful when they appeared before city councils or boards of supervisors to testify, I'm a young person and this is what I'm seeing in my community. So gathering all of your stakeholders through your coalition and including youth in that is tremendously important to get the popular opinion in your community and then to persuade your decision makers as well on the importance of tobacco retailer licensing. Many communities, many states already have tobacco control programs that help local communities organize their coalitions, and that's the case here in California, where the state funds the counties to work on tobacco control, and there are coalitions in place. If you're not one of those, then you'll have to do a little bit more legwork to get your coalition in place and start that organizing process. But because tobacco retailer licensing is a regulatory policy that has to be adopted by a legislative body, it's really important to get that community support in order to get to step 5, which I'll move to. And that is to educate your decision makers on the issue and garner your public support. This is really a matter of the campaign that you organize in the coalition, meeting with local officials, meeting with the public, and really preparing to address the counter arguments as well. Tobacco retailer licensing is a policy that affects businesses. It's the requirement that they get a license. It's a requirement that they pay a fee in many cases. And it's another regulation on business. And if you've been working in the community, you are well aware that there are many decision makers who are reluctant to put any more requirements onto business. So you have to be prepared to counter of why it's so important that it's necessary to put another regulation on the industry in order to protect the community's health and safety. And also to meet with your local officials with your information and your clear messages that you have prepared during your campaign building. So that's the first half of the playbook. So you've identified, you've conducted your assessment, you know what's going on in your community, you've defined your problem, you've done your legal work, you've done your campaign organizing, you've met with your officials, and you think you're ready to get the policy in place. Then it's time for the next step, which is to actually put pen to paper and create a strong TRL policy. And there's a lot of work with tobacco retailer licensing that goes on after the policy is drafted during the implementation and enforcement phase. But all of that work is really put into place by what the words are in the policy itself. And I do a lot of legislative drafting, so I'm very sensitive to the fact that the language in the policy has to be clear and understandable by both the government officials that are going to enforce it and by the public that's going to have to follow it. It can't be too vague so that they don't know what is going to, what their duties and obligations are going to be. Every single aspect of the program does not have to be in the policy itself written down, but I think the key elements do have to be in there, such as how you get a license, how long is a license good for, how do you renew it, what is the fee, what are the performance standards or the requirements that the retailers have to live up to, what happens if they don't. Those kinds of things have to be in the policy itself, otherwise it's too vague to know what, for the retailers to know what's going to happen to them or what they have to do in order to comply with the law, and it might be too vague for the government to actually enforce. So aware of that, at our office, we, in 1998, a long time ago, predates me, we set forth our first model policy. It's a model California ordinance requiring a tobacco retailer license, and it's been revised 5 times since then to reflect what we've learned from the field. So the revisions reflect some issues that arose with the license. We tweaked the language, we've clarified it in some cases, but it really stems from our first model. And the model is a plug-and-play model, which means that there are blanks in there where there's policy decisions to be made. We set forth commentary to help make those policy decisions. And so you can plug in your own information, but all of the elements that I just talked about that we think are important to include in the actual ordinance itself are in there as well. And although it's a model California ordinance, really once you've done your legal analysis, if you're in a state that allows for local licensing, you can really tailor this language very easily to whatever state that you're in, because a lot of it applies no matter what state that you're in. So this is on our website as well, and we'll give our website address at the end at the end of this webinar as well. So you put pen to paper, you have your ordinance, and you've persuaded your decision makers that they should adopt it. Now you're starting to think about how are we going to implement and enforce this policy once it is in place. And a word on implementation and enforcement in this context. Some laws are said to be self-enforcing, and I'm using air quotes with self-enforcing. A lot of times outdoor smoke-free air laws, such as no smoking in parks, for example, are said to be self-enforcing. And what that means is that if the government enacts the law and alerts the public that the law is in place through signage and public outreach and education, there will be a certain amount of compliance just through those measures alone with no more enforcement than that. Of course, there won't be total compliance, but most people generally are law-abiding and will comply with the law once they are aware of it. And the other citizens who are in those smoke-free places, for example, will also alert violators as well. Hey, there's no smoking here. Tobacco retailer licensing is not a self-enforcing law at all. If you do all of the steps 1 through 6, pardon me, and then you get your licensing policy in place, it's been adopted, and then you celebrate your victory and do nothing else, nothing's going to happen. You, as the government and other stakeholders have to work together proactively to implement and enforce it. So that work has to be done rigorously, and although it starts here in step number 7 of the playbook, it's something that really you need to start thinking about very early in the process, because you can't just plop the policy down and then say, hey, law enforcement, or hey, code enforcement, let's implement and enforce this. You need to work with those agencies early on in the process. And one of the first steps is to calculate the cost to implement and enforce it. There are going to be some costs to go out and do inspections, to issue licenses, to do enforcement proceedings, that sort of thing. And how are those costs going to be met? Well, the first step is to calculate what the costs are. And most of the costs can be recouped through a tobacco retailer licensing fee that is charged to retailers to get the license. A licensing fee is a regulatory fee that can be charged to businesses for the purpose of regulating them. And this is an area where you really need to engage your legal counsel to determine the parameters of how much you can charge for your fee. But generally speaking, the government can charge a fee that covers all of the costs to administer and implement and enforce a regulatory program such as licensing. And so calculating those costs accurately is important in order to tell decision makers what that fee should be, and also to defend it later if the retailers come back and say, you're charging us too much. You can say, no, we've calculated the fee accurately. We have developed an online tool to help you with that calculation. It's on our website here. It's a tobacco retailer licensing fee calculator, and it really is an online engagement tool where you enter information from your jurisdiction about who's going to be doing what functions in order to implement the licensing program, and those functions are set forth on the calculator, and then how many retailers there are, and then you can, it'll tell you what the costs are and then calculate a rough fee for you. So this can get you a long way towards calculating your fee. Once you have your fee, as I just mentioned, you also have to work with the agencies who are actually going to be doing the implementation and enforcement. There are many agencies potentially involved, from the finance department issuing a license to law enforcement and code enforcement, the health department as well. The most important point to remember here is that it's important to work with these agencies early. Again, you can't just plop the law and the requirements down on them. You have to really work with them and say, how can you work with us, and how can we make this law better for you? Okay, the last two elements I'll go through are on the back end. Is once you have your policy in place, it's important to collect the data and evaluate it so that you know whether it's working or whether you need to amend it or not. If your problem was sales to schools, sales near schools, have those sales gone down at all? For example, if the problem was sales to minors, has the sales to minors rate gone down? And there is not a lot of good peer-reviewed evaluation of tobacco retailer licensing yet. Anecdotally, we know that it works very well, but it's not been evaluated rigorously yet. We're looking forward to when it will be. Finally, the last step is additional uses for TRL. And as I said, TRL is a real versatile regulatory policy. I've already talked about a few ways that it can be used for density and sales to minors, for example, but there's really no limit to the number of different types of regulations that you can implement through TRL. Basically, anything that you want to require of retailers in the community can be tied to the license as a performance standard or condition, whether it's marketing or pricing. Anything that you can legally do, you could do through licensing. So I encourage you to start slowly if you want to, but think broadly in the end, because licensing is very versatile. We have a series of plugins, what we call plugins for our licensing model ordinance on our website. We have 15 of them. This is the one for price policy options. And those are on our website, along with all of the other resources I've mentioned, including the Playbook, which I am showing here. And I'm at time, certainly, so here's an overview of the 10 elements I just went through again, and I will turn it back over to Asha for any questions that have come in. Thank you.
Yeah, thanks, Ian. That was great. I think you guys did a wonderful job of outlining the steps to implementing a strong tobacco retailer licensing policy in localities. I was really struck by the first 5 steps of the playbook are really planning steps. And I think it's important to kind of emphasize that the planning and the work you do prior to creating a policy is really important. And so we did have a few questions in the chat box, and the first one was to that point. The question is, don't you need to create a model policy to share with decision makers when you meet with them rather than creating the policy afterwards?
Well, that's a really interesting question, Asha, and I think that there's many different approaches to that. I do not meet with legislators very often, and so I'm not sure that I can say what the best way to do that is, and I do encourage people to come in the chat box with their answers to this, and I think Los Angeles County will talk about it a little bit during their presentation. But I will say that what I've found is that just telling legislators sort of what the problem is that you've identified is more important than actually presenting them with a model policy per se. The policy itself is 30 some odd pages, but I think it's more effective to distill that down into here's the problem and here are the elements of what we would like to do through a policy. It'll be licensing, and this is what it will do. In more lay terms is better information usually than for decision makers than giving them a 30-page policy and asking them to read it. You would want to follow up and say, we have a policy that we can use as a starting point for this, for everything we just talked about, but I think that it's probably too much information to have the actual policy from the outset.
Thank you, Ian. Importance of educating the legislators first on what you're doing and then kind of creating a policy. I think that's important. I have 2 more questions. The next question Is there a real threat of state legislators passing preemptive laws in response to local governments enacting ordinances affecting tobacco retailers? In our state, American Cancer Society, American Heart Association, and the American Lung Association have been discouraging local coalitions from working toward Tobacco 21 ordinances because of this fear of state preemption.
I think, Asha, that is always a concern that you need to be aware of, and it really depends on the political climate of the state. We have seen preemption in tobacco control, and since most of the innovation in the retail environment has happened at the local level, I think that we don't want to see more preemption of local innovation in tobacco retail policies particularly. So that's something to be aware of, but it really depends on the political climate of the state. I will say in the other area that I work in, which is food policy, that we have seen a lot of preemptive legislation that has been almost directly in response to innovative local food policies, such as a policy that bans toys with Happy Meals that are unhealthy. We've seen a number of states that have enacted legislation preempting those kinds of local laws, and they've done it really in what we call vacuum preemption, which is the state doesn't do its own regulation, it just says locals can't do this. So there is definitely the possibility of that backlash, and I think it's really a wise question and something that everybody working locally on tobacco retail policy should be aware of.
Thanks, Ian. The last question is, if there has not been any rigorous evaluation on the effectiveness of TRL, which is the case, how do we know if TRL policies are effective or strong as labeled here and elsewhere?
Well, that's a great question, and I would start off the answer by challenging the evaluators out there at RTI and other places to take this issue on and do some evaluation, because I think it's desperately needed in order to push this policy forward across the country. How we know it is really anecdotal, and I don't mean that in a pejorative sense. I think it's strong anecdotal evidence that we have. For example, in California, the Center for Tobacco Policy and Organizing, which is a great resource of the American Lung Association, they've looked at numerous communities that have a tobacco retailer licensing law that has the key elements and enforcement in it. And they looked at youth purchase rates before and after the license was implemented. And in every instance that they've looked at, the youth purchase rate has gone down significantly, and sometimes it went down to zero. So we have that kind of evidence, and I think Monty and Anina will talk about their evidence from Los Angeles County, which is similar, and that's what we're relying on. It's really what we're hearing from the field, that they know that it's working when they put it in place. But the evaluation groups that are out there, I think this is a great chance for them to step in and do some better peer-reviewed evaluation that we can publish and send along and push this throughout the nation.
Thanks so much, Ian. We have a few other questions in the queue, but we have a conversation that we need to get to. I do want to say that the playbook can be downloaded from ChangeLab's website, and someone put the link inside of the chat box. And I think it's also in some of the notices. A link to the playbook is in some of the notices for the webinar. And my last point before we move on to the conversation is that other programs and communities have mentioned that they find it easier to educate the decision makers about the problem before they actually present with the model policy. So with that, we will begin a conversation with Monty and Anina from the Los Angeles, from LA County. And they've done some excellent work on tobacco retailer licensing. So we'll just begin with a few questions that I have for them. The first question is, please tell us a little bit about Los Angeles County, the size, the demographics. Are TRL policies prevalent in the county?
Hi, Asha. Hi, everybody. Thank you. We'd like to thank ChangeLab Solutions and CDC Office on Smoking and Health for inviting us to be on this webinar today, and we're definitely happy to share our experiences with everyone. And to start off, let me show you guys a map of LA County. So LA County has a little over 4,000 square miles with 10.1 million people, which is about a quarter of the state's population. And it's the most populous county in the United States. And we have a very diverse population, and it's 88 cities and unincorporated, a vast unincorporated area, as you can see in the map. And one of the cities is, of course, the city of Los Angeles. It's the second largest city in the U.S. And so the LA County Public Health Department, we handle public health work for all of the unincorporated areas, as well as 86 of the 88 cities in the county. And the remaining 2 cities are Long Beach and Pasadena, and they have their own health departments. And of course, we support each other and collaborate as needed. And yes, so tobacco retail is very prevalent. Retailer licensing, is very prevalent in the county. And let me show you another map here. This map is the latest policy map that we have showing all the cities in LA County with the TRL policy. There's a total of 41 jurisdictions in LA County with the TRL, including the county's unincorporated area. And our program has assisted with 39 of those policies. And the other 2 are in Pasadena and Long Beach, and they have their health departments worked on them.
Thanks, Adina. That's a lot of licensing policies that have been adopted. How is it that so many cities have adopted TRL in the last decade in LA County?
Well, so since early 2000s, our funder, which is the California Tobacco Control Program, they encouraged all their grantees to work on tobacco retail licensing. And so in 2005, our program started subcontracting our TRL work to community-based organizations, and we also required them to use a phase-based model to pursue tobacco retail licensing in various cities throughout the county. And this model is called the Policy Adoption Model. And it's a step-by-step approach for organizing local policy campaigns. And we described this model in the article that you see in front of you. It was published in the American Journal of Public Health in 2012.
Nice. It sounds like the policy adoption model you use has been tremendously successful. Could you tell us a little bit more about the model?
Yeah, sure. So let me show you guys a graphic here. This shows you an overview of the policy adoption model, and basically the model divides the local tobacco policy campaign into 5 distinct phases, each with a specific objective and several related activities. And the phases build on top of each other. So we use this model actually for all our tobacco policy campaigns, not just tobacco retail licensing, but also smoke-free housing and outdoor areas. And there are several activities in each phase. And since we don't have enough time to go over all of them, I'll give you guys an overview of each of the phases and highlight the key activities that are directly related to tobacco retail licensing. So the first phase is community assessment. And this phase, it helps define the problem and gather evidence for your policy. And you can see that it closely aligns with the playbook, step 2 of the playbook that Ian talked about. And as I go on, you'll see that all our phases in the model, it aligns with parts of the TRL playbook. So the key activity for this phase is implementing a youth purchase survey, conducting a youth purchase survey in the community that you're interested in working on. So that's basically an undercover youth decoy operation to see whether or not retailers are willing to sell to minors. And so the subcontracted agencies we partner with, they go out to the local community and recruit youth to conduct a survey. And then once we have the results, our program analyzes the data and generates a GIS map, kind of like the one you see in front of you. This is from the city of Redondo Beach, and it shows you retailers that were willing to sell and their proximity to youth-populated areas such as schools and parks. Okay, and then that's just one example of the activities in phase 1. And in phase 2 is the policy campaign strategy phase. And this is where we design the policy campaign. And the key activity here is completing a Midwest Academy strategy chart, and you'll see a sample of that on the slide here. So basically, this is the blueprint for your campaigns, and it identifies policy goals and as well as coalition members, allies that you'd want to work with, and also decision makers in the community. Another thing it does is identify strategic activities to keep the policy efforts moving forward. And then once you've done that, we have the phase 3, which is a very important phase. It's coalition building. And this is in order to mobilize support for the policy goal. So the key activity here is recruiting constituents and allies identified in your strategy chart from phase 2. So for TRL, since it's all about protecting youth, the main focus here is on recruiting youth as well as youth-friendly organizations. So church groups, PTAs, Boys and Girls Club, and the health voluntary organizations, etc. So the picture here is actually our coalition in Burbank, and this is taken right after they passed their TRL policy. Okay, so after phase 3, we have phase 4, which is the policy it's the policy campaign implementation and adoption phase. And so this is where the local coalition implements tactics that are identified in the strategy chart to educate key community leaders and decision makers. And this picture is of an LA City Youth Coalition member providing testimony during a city council meeting as part of their efforts to strengthen LA City's TRL policy. So the final phase, phase 5, is policy implementation and enforcement. This is to ensure that provisions of the adopted policy are implemented and enforced. So our subcontractors actually often go back to the cities about 9 months after the policy adoption, and they conduct a post-policy youth purchase survey. Now, if there's been active enforcement of the policy, the rate of sales would have gone down by then. And this information will be shared with the local coalition, and then they'll work with the city as needed. As I mentioned before, the LA County has a TRL policy, and we actively enforce it. And this picture you see is taken after an undercover youth decoy operation in LA County, and this is a critical part of our TRL program. And that's the overview of the policy adoption model for you.
Thank you for that information. It looks like a lot of people are interested in seeing, getting the actual sample chart of your model. You mentioned that the county itself has a TRL policy in place. Can you tell us a little bit more about that policy and how it's being enforced?
Yeah, sure. So Monty Messick, he was actually here to help create the program back in 2007. So let's answer that question. Monty?
Okay. Thanks, Asha. So here, okay, so in 2007, the Los Angeles County Board of Supervisors adopted a tobacco retail license that included a $235 fee that funds administration and enforcement of the license. The ordinance requires an annual compliance checks of all tobacco retailers and allows for suspension and revocation of the license. This slide is of Supervisor Yaroslavsky, the TRL's champion. It was very important to the board that the fee was calculated to cover all costs of the TRL program. So you can see in the comments below the supervisor's photo that he's talking about that the fee has to be full cost recovery. By way of background, the county's TRL was a result of a policy adoption model-based policy campaign similar to the one described just by Anita. The county TRL is housed in the Tobacco Control and Prevention Program and licenses about 800 tobacco retailers in the unincorporated area of the county. In terms of partners, the TRL program has agreements with the Sheriff's Department, They conduct youth decoy operations, similar to what Anina just talked about. We also have an agreement with the Environmental Health Program here in the Department of Public Health, and they conduct tobacco retail inspections. And we also have an agreement with the Department of Regional Planning, and they provide us with reviewing officers for administrative hearings.
All right, thanks, Monty.
And as I mentioned previously, the ordinance requires annual compliance checks for all tobacco retailers. So the Sheriff's Department conducts youth decoy operations of about 175 retailers per year, and typically the Environmental Health Program conducts retail inspections of about 600 retailers per year. So Environmental Health uses this tobacco retail license inspection report to document and correct tobacco retailer violations they encounter, such as not posting a valid county retail license or the sale of single cigarettes. So this is actual scan of their report that they use in the field.
Thanks, Monty. Would you say that TRL overall has been a successful policy in LA County?
Well, it has been, and I know that there were some questions earlier about kind of whether or not the policy has been successful and has been analyzed. And of course, this is anecdotal evidence because there hasn't been a rigorous evaluations done. But we've seen illegal sales rates go down in cities that adopt strong tobacco retail licenses that include dedicated funding for administration and enforcement. So here are a few examples from Los Angeles, from cities in Los Angeles County. So for example, in the city of Baldwin Park, the rate of illegal sales dropped from 34% before the TRL policy was adopted to 9% after. And in Pasadena, the rate dropped from 20% to 0% after it was adopted. And keep in mind that these rates, the before and after rates, in some cases, the before rate will be a youth purchase survey that was conducted by a community group, and the after rate will be enforcement data that was conducted by, say, code enforcement or the Sheriff's Department. So in some cases, you are comparing apples to oranges in terms of how the data was collected. So it kind of gives you just an idea of the fact that when these policies are adopted, the sales rates do drop. But as Ian said, it would be great to actually have some rigorous evaluations done of these policies.
So what's next for LA County?
Great question. So what's next? There are a number of emerging tobacco products that pose concerns for us, and I think Ian mentioned some of them. So such as little cigars and e-cigarettes, and these products can be regulated through a tobacco retail license. So little cigars, as many people know, are flavored and often sold individually and are attractive to youth. A 2013 study found that 80% of LA County stores sold little cigars and cigarillos, and the most popular brand of cigarillo was under $1. So although little cigars and cigarillos are typically covered under a TRL, they are a tobacco product, a provision can be added to eliminate single sale of these products and thus increase the price and make them less attractive to youth who are price sensitive. So in Los Angeles County, one city has adopted such a policy. So those types of policies are not as common, but the city of Huntington Park did adopt such a policy, and our subcontractors that are currently working on tobacco retail licensing are doing youth purchase surveys that are actually doing cigarettes and also doing a youth purchase survey for cigarillos. So we're collecting that data as well and hoping to pass some policies that include those cigars. Another product that we're concerned about are electronic cigarettes. They pose a concern for us. Of course, they're flavored and they're also attractive to youth. They're particularly unregulated here in California in the retail environment, and they're prevalent in Los Angeles County. In California, the number of stores selling e-cigarettes quadrupled from 11% in 2011 to more than 45% in 2013. And in LA County, a recent survey found that 36% of stores sold e-cigarettes. And I can only imagine that the number of stores is on the rise. TRL can be used to regulate this product in the retail environment. Ian mentioned that earlier. For example, by including e-cigarettes in a TRL, you can ensure that the same restrictions apply to the sale of e-cigarettes as do other products, such as combustible tobacco. Currently, the Department of Public Health, here in Tobacco Control Program, and our County Tobacco Control Coalition are working with cities to strengthen existing tobacco retail licenses to include e-cigarette provisions in those policies. So shown here on the screen is a copy of LA City's e-cigarette TRL that was adopted in 2013, and it also includes a self-service display ordinance that applies to e-cigarettes. So our county coalition and Department of Public Health and Change Lab Solutions worked with the City of Los Angeles to strengthen their existing TRL to include e-cigarettes by amending their definition of tobacco products. And as I mentioned, Change Lab Solutions was a vital partner actually in that endeavor. So anyway, I think that's about it for Anina and myself. And moving forward, we hope to work on more comprehensive TRL policies here in LA County and to work with non-traditional partners from the fields of alcohol and nutrition as we attempt to build a healthier retail environment. So again, we want to thank the CDC, Office of Smoking and Health, and Change Lab Solutions for inviting us to participate on this webinar, and we're available for questions.
Thank you, Monty and Anina, for sharing your experience. You guys have done excellent work, and you have a lot of history implementing TRL in your city. So thanks for sharing. We do have a couple of questions in the queue. The first question is, of the 41 policies, how many of them are strictly licensing versus having add-ons that limit the number, type, or location of retailers?
They're all tobacco retail licensing policies, and then on top of that, some of them include additional provisions such as e-cigarettes, but they're all basic tobacco retail licensing policies.
Do you guys have? Do you know how many have actual plug-ins, and then how many are just the license?
Off the top of my head, I don't have that information, but
okay.
But a significant number of them actually include e-cigarettes.
Great.
That's over 20.
Yeah.
It's over 20?
Over 20 include definition of a product that includes e-cigarettes.
Thank you. Okay. We have a couple of questions about sharing a copy of the policy adoption and implementation model. Would that be possible?
Yeah, absolutely. So that's an article that was published in the American Journal of Public Health in 2012, and it's available through the American Journal of Public Health in 2012.
And you guys can also contact us, and we can email that to you directly if you're interested.
Okay, we have a few other questions. What part does regional planning play in this?
Regional planning. Well, I would say regional planning in the sense that we're funded by the state's Tobacco Control and Prevention Program, and the Tobacco Control Program at the state level funds all of the health departments, and they really, back in the early 2000s, set the policy agenda for all of the health departments for us to work on tobacco retail licensing. And that created a considerable amount of momentum. So as one city would adopt a policy, then another city would adopt a policy. So, for instance, Orange County was working on tobacco retail licensing, as Ventura, Kern, and many other counties throughout the state. And they also funded technical assistance, so Change Lab trained us on tobacco retail licensing as well. So there was a considerable amount of infrastructure that came down from the state to work on tobacco retail licensing.
Thank you. It's great that you guys have a great working relationship with your state program. I'm going to take two more questions. Does the TRL policy cover vape shops that don't sell cigarettes?
So some do and some don't. It's really at the discretion of the policymakers and of the city council. So, for example, the city of Los Angeles decided to exempt vape shops in the sense that they allow vaping in the vape shops for their usage ordinance, but the TRL policy does apply to the vape shops. So the vape shops are covered under the TRL policy. And actually, TRL policies are really excellent for vape shops, because what it does is it allows the jurisdiction to know how many vape shops actually exist within their boundaries. And believe it or not, a really excellent resource that we use when we're actually working with local jurisdictions to be able to tell them how many vape shops are within their boundaries is Yelp. We'll go on Yelp and do a search for vape shops, and Yelp actually turns out to be really a pretty excellent resource in terms of getting at least a ballpark figure of the number of vape shops. Most jurisdictions don't have any idea about how many vape shops are within their boundaries.
We will continue to look to you guys to see how you tackle that in the future. Okay, the last question, I guess this is a general question to the speakers on the call. Does anyone have educational materials to provide retailers about what they can do to prevent youth tobacco use?
I'll just put that one to Ian.
Yeah, hi, this is Ian. I think the short answer is we don't. Because I think that in tobacco control, we've really taken more of a regulatory stance with tobacco sellers, at least in the last couple of decades. But there are a few resources that I'm aware of. One is that the State Board of Equalization here in California has trained tobacco retailers. I don't know if they still do it, but in recent years, going back a couple of years, they did train tobacco retailers on compliance with tax laws, and I think that was an area where they also handed out some information about existing sales to minors laws to those retailers and included a short bit on that. And of course there have been some industry funding campaigns as well. But other than that, I'm not aware of any great resources to share with retailers to educate them about not selling, but I think that it's it's a component that has been included in some local licensing laws. It's an outreach and education component, and as a condition of getting a license, the retailers have to participate in some training, and I think that it's a wonderful opportunity to engage the retailers and have them engage in that type of training.
Thanks, Ian. Just the final note, I want to say that thanks to everyone for being on the call today. There was a lot of great information shared. The recording will be sent to everyone that registered tomorrow, and the article that Monty and Anina mentioned earlier will be available with the webinar archive once the recording is available. Thanks to everyone. Have a great week, and we'll see you at the next webinar.